Good morning or good afternoon. I'm Donnell. I have Dr. Raye Taylor with me as hosting the Maddie's Fun Community Conversation. Today is Monday, May 5th, and today's topic is discussion on veterinary barriers. And the question of the day is when trying to work with veterinarians, what kind of barriers have you faced? And so feel free to put in the chat, uh, what you guys have faced. Dr. Ray, what other veterinarians, what have you barriers have you faced?
I like the list is long, right? So I like to think about it in two different worlds of like, what do you face as a barrier to any choice that you make to volunteer? Like anywhere. And we'll talk a little bit more with that with Dr. Michelle today. But also, then it really changes sometimes drastically from what you would do if you're considering to volunteer in a veterinary or animal care capacity, because the stakes kind of change dramatically. So we'll kind of dive into that today. But love seeing people putting some ideas from all over the country since that's where you guys are joining us from. So anything that you can share, we want to see if there's some themes about the barriers that you're facing with working with veterinarians and veterinary teams, or if everyone's really experiencing a wide spectrum of things. So please share in there. We'll see kind of how well that lines up with our talk today, and if we could shed some light on those things.
Amber put in the chat, we struggle finding veterinarians that are fast at spay and neuter and okay with some procedures we ask for.
So I can like clarify on that. So our dog rescue, actually, we have a clinic that is part of the rescue, and we're really struggling right now to just find veterinarians that are able to, like I said, be a little bit faster with spays and neuters. I think a lot of the time when you're working private practice, you're being so particular, and here we're like, we have a lot of animals that we've got to get through. You still want to do it appropriately and correctly, but we still need to like move these animals through. And then also too, just as a rescue, working with some of the procedures that we ask for, that might be a little bit atypical for a common animal practice, but that we're asking them to do. And so just having kind of different personalities and working in a rescue setting full time can be tough for some vets.
Thanks for that, Amber. I totally understand. When I was looking for spay and neuter for owned animals outside the shelter, just because we didn't have any capacity, and looking at their procedures, our procedures, see what lines up is very different. So yes, finding veterinarians who are on the same page, or practices are on the same page that could align together. So it's going to not cost so much, but also getting what we need and actually doing many more surgeries. So
exactly. And with our insurance, we've had a really hard time with insurance. And right now they do not allow any sort of biting animals. And so when we have an animal bite, we have to do behavioral euthanasia. And some vets are really not okay with that. And so, which is understandable, but just something that we have to do as a rescue.
and Dr. Ray, have you seen themes in the chat?
I think there's some themes between this and some of the other talks we've had in the last couple of months is the skill set. You know, Amber really talked to that. What kind of skill set does a veterinarian have, and whether or not you can find one with that, or you're finding people that may be willing to work with your organization, but don't meet your skill set needs. So that mix of what do you do? It's not a warm body is not a warm body, right? You need someone that has a skill set that matches your needs. It looks like pay, you know, certainly is a theme that we're seeing. We'll talk a little bit more about that today. And David, are you able to unmute it all by chance? David Fisher.
I am, yes.
Would you just speak a second here about your point that you made? I'd love you to articulate that for the group.
So we have a requirement that you have to be spayed or neutered before you leave the facility, but the respiratory illness is so pervasive inside the facility. We're normally running well over capacity. So we have about 170 kennels, dogs more specifically, but we're also seeing any cats, but we're regularly running at about probably 220 for dogs in the facility. And so we're getting a lot of respiratory. And so the vets are declining because of the respiratory, but it's lasting for weeks. And so it's messing with our length of stay. It's messing with us having to follow back up with people. But, and then I know it's a wide mix here. I work at a public shelter, but, the animals that leave that are not spayed and neutered, there's a strong, head butting around people who feel like the animal should never leave without spay neuter, even if they were getting euthanized, and those who feel like just get them out as fast as humanly possible. So it's just a lot of navigation.
Thanks, David. That's kind of what I wanted to hear a little bit more. This is something that we deal with everywhere, whether you have a foster and you're one pet, or you're a clinic and you've got one animal, or you've got a municipal facility that has hundreds of animals. When we're dealing with disease and policy, they can often clash and create whole new headaches for all the people involved. So thank you for sharing that.
All right. If you're just joining us, say May 5th, the question of the day is, when trying to work with veterinarians, what kind of barriers have you faced? Feel free to put it in the chat. I think we're going to keep going to national updates. Feel free to unmute. We'll give you 30 to 60 seconds each person so we keep this moving. So anyone wants to unmute and national updates.
Hey, this is Kristen. I'm the technical tabby at the Community Cast podcast. We have coming up next Wednesday, surrender prevention course. It's taught by Dr. Rachel Geller, and it addresses the big main reasons why cats are surrendered, and teaches people how to work with the owners' limitations to solve those problems before the animal gets to the shelter. So I will put the details about that in the chat, but we do have some scholarships available. So if it's something you're interested in, but the registration is a barrier, it's an awesome time to do it. So excellent. Thank you, guys.
Hi, I'm Sheila Segerson from Maddie's Fund. Allison already posted it in chat, but just wanted to let you all know that Maddie's Insights this Thursday at noon Pacific, 3 p.m. Eastern Time. Rachel Morrison is going to be speaking to us about her really interesting research looking at factors that influence public engagement of adoptable pets on social media. So what were factors related to photos, posts that made people engage more? So a really interesting one, and hope you can join us.
Hi, everybody. Can you hear me?
Yep.
Yeah. So I work with the Animal Care Foundation. We're not a rescue, we're an intake diversion program. We help folks who are either elderly or senior citizens elderly or disabled, access veterinary care for their pet so that they don't end up sending their pet to you guys. And we actually get most of our funding by doing a CE seminar, which is coming up on May 15th. I'll put the details in the chat. It's for veterinarians and technicians. We do have a virtual option. If you are in Minnesota, you could also come and join us in Minnesota. We're going to be in Minnetonka. But it's 8 credits. It's race approved. It's updates in veterinary medicine, so it should be pretty interesting. We do have 2 hours on spay neuter stuff by, I believe, Peggy Root is the one who's going to be doing that session. So check it out. It should be really interesting.
Thank you. And thanks for dropping that into the chat.
All right. If there's no more national updates, I guess we can go on to the main event. I will turn this over to Dr. Raye.
Thank you very much. Team, we're going to have hopefully a little bit more of a relaxed conversation today. And it is very exciting for me to welcome one of my colleagues, Dr. Michelle, to our coffee chat. Come to our coffee shop with us. We're going to take a little sip. We've got some May the 4th spirit from Dr. Moyal. And for those of you who don't know me and my guests, we'll take a second here to just let you know who we are. And we're both veterinarians. So we've had all kinds of different routes, but what we share is our love for humans and animals together. So I am currently a professor at the University of Minnesota. I teach in community medicine and surgery, specifically in small animals, but I also work in regulatory and get to spend a lot of my time with various animal welfare groups, especially in reservation services within my part of the country. So those are my personal passions. And that's a very short story. Dr. Moyal, you have not joined us before on Maddie's Community Conversations. Could you share a little bit about yourself, what you do, and what you have done up until this point?
Yeah, I'm super excited to be here. The chat alone has made me start really just getting excited about this conversation. A little bit about me, because I've done quite a bit of things, and I think I have some different perspectives, hopefully, to bring to the conversation. Graduated from vet school in 2007, did an internship focused on emergency medicine, stayed in emergency medicine for quite a few years, teaching interns, and then left for general practice, where I'm from in New York City, where I really picked up a love for the, I'm going to say spectrum of care, but understanding that people with limited finances also deserve care. And also worked with some TNR groups and foster groups there out of our practice, which was really fantastic for me as a doctor. And then 5 years ago, I left and became the chief of a service called primary care surgery at a veterinary school here, actually at Cornell, and was there teaching students. And I think that some of the things I saw in the chat, that maybe understanding more about what our students learn will lend to some more conversation about this, because I think it's important that everybody know a little bit more about that in depth. And then recently, within the last year, joined the Purina team, right? So I'm a veterinarian, part of a veterinary team that works on the therapeutic diet line, but mostly on education. So I still educate students, I educate doctors and staff. And so I've kind of broadened and branched out into things that I never thought I would be doing and never thought I would find myself in this aspect. But at heart, I am a general practitioner who loves being a veterinarian. Yes, even on the toughest days. And so, okay, I'm going to stop because that was a lot. That was a lot.
That is the very short version.
That also was a short version for all of you. Yeah.
So I thought that this would be a really great conversation for us to have, because we are in this unique multiple pronged spot that we get to see these lenses of being what it was like to be a general practitioner in various different environments, as well as having this, I think, personal belief system of servant leadership that we both exemplify, and having this component of teaching. So we're seeing these, the understanding of animal welfare and of surgery and volunteering from very differing lenses. And so I think before I forget to ask this question, one of the things that you hit on that is excellent is that just strictly as a professor, as a teacher at a university, what would you want everyone to know that a veterinarian graduates? Like, what skill set around animal welfare, around surgery, TNR, high volume, high quality spay neuter, what do they know? So what would you want the public to know?
That's a great question. What I want the public to know is that there's no standardized formula at any of these vet schools. They are doing what they can with their resources and their curriculum to try to figure things out. At the institution I was working at, there actually is, because I think I saw something in the chat, there actually is a shelter medicine specific, there are courses on it that our students can opt to take, which is really nice. So if they have an interest, they could take some of these additional courses. And there is a rotation they could take, very much focused on learning shelter medicine, high quality, high volume spay neuter. But it's a tough rotation to get into, right? These students are competing because, again, we only have a few doctors in the shelter med program. And I can't speak for them. I don't know how many exactly that they have. But what I want people to know is that there's interest there, but a student taking one rotation And as someone who taught surgery, who taught, spay and neuter in the general practice, I really appreciate that someone mentioned that, because they are different. They are very different. Our students often don't walk out confident, right, with 2 weeks of a spay neuter rotation under their belt. So kind of coming back to what you said earlier, Ray, they might be really interested. They might want to go to your program and they might want to volunteer their time. But what they can do and maybe your expectations right now may not align. And so we do have a lot of students that take the opportunities. So just for everyone listening, whether or not our students would have opportunities to apply to programs, right? To do spay and neuter programs all over the place. They can go even, like FAR vets trips and things like that. But it's still, right, they're working under the confines of time. So they may still not learn the technique and the skills that allow them to be as confident as they want to shine in the setting, or to make them feel confident enough to volunteer. It's a lot.
No, I feel like I see the same thing, the interest or the want or the wish, but not the time. And
yes.
It has always amazed me about how many students come through veterinary school. Like they've had experience from whatever life and jobs that they had before undergrad and or life if they're a non-traditional student, and they come into this space. And I'm seeing them like you have, and teaching them their small animal surgery course, the first live animal surgery course. So they're doing their spay or neuter. How many of them, of the 126 students, it is literally the first time. And that's it. And they don't have a surgery the next semester. And they only get that one day of a semester, and it's really not enough. And then that's hand memory, and they're learning how to handle their instruments, and they're learning the space of, and the animal is alive. This is not a cadaver or a practice model, anything that they've been exposed to. And that the variety of experiences for seniors, and they're doing clinical rotations, can be everything from you're in the room and you just get to look over, 5 people's shoulders to be able to see what's going on, but you don't actually get to tangibly do those projects. Or do you have externships or unique training opportunities? But so that even then is a really small block of time that you get to spend doing a particular skill set. So we have them so spread out within the veterinary education that very rarely do we get a graduate, a fresh graduate from veterinary school that has really good competency in their surgical skills. And some of that's
Agreed.
For good, because we want them to really, really handle their core skills, handling instruments, understanding suture, understanding healing, and having that kind of understanding of the process before we advance their skills.
Yeah. And actually, and I really appreciate that. And I want everybody to know, this is what's tough. It was very tough for me as someone running a rotation to tell students that speed was not necessarily speed was not the way we knew they were doing well in surgery. As a matter of fact, in some instances, many were rushing because they thought that fast meant that they were competent, right? The faster you can go, the better you must be as a surgeon, kind of negating those small things like sutures falling, right? Knots falling appropriately. And that's what I worked on. And so often it was tough for them to work with me because I was like, pause. We have to redo that throw, right? So the goal here for all of us is obviously we want someone who can work quickly, and that will come with time and with practice, but we want them to be competent, right? We want those throws to land because we want what's best for the patient. We don't want complications.
Those solid skills are super important in the beginning. So if we take that and we look now at maybe people who have been practicing out in general practice, or if they're working with a shelter, then we get to the situation, if they're in a shelter medicine area, it's kind of built-in mentorship a lot. But if you're in a private general practice situation for companion animals, it's not so easy to get that kind of training. What opportunities have you seen for veterinarians, like if we weren't teachers, to get additional training or opportunities to change your skill set now to more specialized?
So I talk about this still with students actually, right? So I think when I look at it as a general practitioner, I think about two different things. One, mentorship. I'm saying that word, but that word has many definitions. As a person who worked in a very busy hospital who wanted to provide mentorship to new doctors, often time was so difficult while we were trying to balance other appointments and other surgical procedures and trying to help these young doctors develop, right? So mentorship could be key. And then we have these opportunities as long as a practice is willing to invest in them, right? In sending these young doctors to labs and things like that. Now, that being said, working on a cadaver is certainly not the same. My first PU on a cat cadaver was not the same as when I did a PU in practice, as demonstrated by my stress level of my first surgery there. But what other opportunities can we generate, right? Maybe your new doctor is watching you do it, or maybe you watch them do their procedure multiple times. Like you can send them to do some relief work or work in a shelter and get some I'm going to say practice, but just get some experience under their belt, right? They say that doing a procedure, I think the number is about 6 times, will make our newest doctors and our students feel a little bit more practiced and more confident in tackling the next few. Those are the big ones that I've seen. I mean, there may be many other opportunities available.
I think that that's the challenge. Like there isn't one at all. And so if you're a professional and you want training, now you have a whole new set of barriers is how do I get, and typically you're getting that training somehow outside of your normal work that you are already doing. So now you're looking at an additional time commitment.
Correct.
So if you're going to training at a different facility, now you've got time to think about, travel to think about, and grants. So we have some of our smaller groups that they're like, okay, I can't do anything about this, but I'm going to challenge you guys to think about maybe you can play a part of it. Or say you have one of your veterinarians that works with you, they just can't always work with you. But then maybe there's a younger or newer veterinarian that is interested, they just don't have the skill set. That you could work towards having the facilitating role of putting them together to kind of help someone with that mentorship. Or if you're doing any type of mini grants or funding, that you can target that towards, I have a volunteer or someone who works at a reduced rate or someone that works in addition to their current job that wants to work with us. And we want to support them in this training so that they can have more of a shared mutual benefit. And so we'd like, a grant for X amount, because often funders like the opportunity to know exactly where that dollar is going. And when they can see that specific name associated with that, that can be really enticing, especially to some private owners or small donations rather than a large grant. So I like that idea of really kind of encompassing that. So when you shift a little bit to like when I've been asked to volunteer for things, like we really think about like what all have you been asked to volunteer? And this is paid, unpaid. What kinds of things are you asked to volunteer for as a veterinarian? Just, I'm guessing we all have similar experiences.
Yeah. Well, to give talks, right? Like mentor meetings, a lot of those, just meeting to talk about future options, clubs, surgical procedure review, vaccine clinics. I've been asked to volunteer my time at my job when someone else was ill for no additional pay. Like I know it may not sound classic, but that was volunteer work, right? In a way. Gosh, there are so many things, it tends for me now still to be volunteering with students and student activities. But for the veterinarian who's in practice, again, it could be, and again, like local VMAs, talks there, volunteering your time, again, mostly at clinics or volunteer work at shelters and things like that. So it's beautiful opportunities to do work. The question is, can we do it? Like, can we fit it in?
There's so many.
So many.
The list is so long, and you're right. You hit on this. There's the things of personal passions like students, and that could be a student in your own clinical setting. It could be an assistant or a receptionist that wants to learn a skill, another doctor that wants you to spend time with them, work on things, talks all the time, your local veterinary medical organization saying, hey, we've got the golf classic this weekend, or we need hands to help us with the booth at the state fair.
Yep.
We've got regulatory things like the boards of veterinary medicine. Those are often volunteer positions from the veterinarians and technicians of the state. There's a lot at work, and do not discount the volunteering at work. Like, I need you to serve on this committee. Can you go here to the Children's Museum for this expo day? And those are just vet associated ones, let alone outside of, like, maybe it's the fun at the park. Maybe it's the, whether you're on this committee at church.
Career day. That's a big one also.
Career day.
At multiple institutions. Yep.
Local schools, huge Boys and Girls Clubs, YMCAs, Lions, Rotary, all of these things. Because as a more prominent member of the community, you're seen, right? And so your community is saying, hey, we want to ask you there. So this is huge, I think, to understand that just the idea of asking a veterinarian for volunteering hours or to be associated with an organization, you're competing against a lot of different opportunities and asks. So if you can change your opportunity to acknowledge that and to be competitive, that could be one unique way to, elicit some activities from veterinary professionals that without realizing that you wouldn't necessarily have a competitive edge.
Yeah. And I do, what I want to highlight, because I see some things in the chat, and I think we'll get to them as well. Sometimes my saying no to volunteering wasn't because of the pay, and it wasn't because there was lack of passion. Every day I live my life in service of, like, the human animal bond and taking care of my patients. Really, truly, I'm very proud to do what we do. But I'll give you an example. I used to drive 2 hours in traffic to my job. I would work, let's just say, an average of 14 hours. And I work through lunch. I know we all do, right? I work through lunch. I'm eating on the run. I'm doing a bunch of procedures. I'm running into appointments. And then, evening appointments never end on time. And then we're doing records because, of course, we skipped some records because we want to fit in those appointments that walked in and those emergencies. And then I'm trying to do blood work. Oh, maybe I'm doing emergency surgery. And then I leave to drive home. And maybe the drive is shorter, but I have maybe 6 hours of sleep, and then I do it all again the next day. So believe me, with the core of my being, I would want to volunteer, but literally I felt like I had nothing left. And I'm sure a lot of us feel this way.
I think that's the whisper, right? That people hear more and more about, but without acknowledging that deeply in this space, we would be doing ourselves in its service. The mental health decline in our profession is startling. It's scary. And that's happening even before vet school, right? It's having a shock factor. It's having a deterrent from people entering our profession because it's a known problem. Like, the work-life balance isn't there. And so when you have people who have these amazing hearts and passion, trust me, no one says, I'm going to be a veterinarian for the pay.
Yeah.
Nobody says that.
Yeah.
So the people who are here, who are showing up in the profession, they're here because of that passion, because of that love, that feeling of wanting to facilitate the relationships of animal welfare and life.
Absolutely.
And health. So it unfortunately creates that pull. It makes us susceptible to things like guilt, susceptible to things like overworking and deprioritizing ourselves. And even the stigma of a veterinarian saying no that they might receive can be really painful and can really mess with an individual as they're receiving that kind of negative feedback over and over again. And unfortunately, it's true. There are phrases that have been said, and unfortunately, not just once or twice. Like, if you loved animals, you would do it. And these are not just by organizations that are asking for help. Literally, clients are sometimes saying these things out of desperation and anger and not understanding. So our goal with today is just to increase that understanding. What other kinds of phrases have you heard, either personally or from people that are those kind of that shock or that driving in the downward direction that can be painful to hear?
I have heard that. that very phrase, like, but if you cared, and that's always tough. That's really tough. Saying no, because I'm someone who said yes almost all the time. And then I almost got to the point where I was like, I don't know if I could do this anymore, meaning veterinary medicine. And if you know me, whether you're a student or someone who's worked with me, I hope you know, like, I really, really love this job. So then I knew something was wrong. And then I'm just going to highlight the guilt of saying no, right? That's very difficult, saying no to a client, you know. And then the other thing is feeling powerless. Like I sometimes wish I could, you know, do something for free, even though, by the way, I want everybody to know this. I would love to do things for free all the time. But the truth of the matter is, and I'm going to say this because I tell our new doctors this, we are doctors, and our time, like we invested a lot of money and time into our skill set. And so we should be paid the majority of the time, right? Unless we're volunteering. But while we're doing our job, asking us in the middle of it, like, well, you must not care, or I don't understand why you can't do this. It is so, so tough. I'm trying to think of some other phrases. I mean, I've had people just walk out of talking to them when they were so upset. Yeah, I've been threatened. That was tough. That was very tough. I didn't expect that. No one teaches you that in vet school. You probably could attest. Because emotions run high, right? And of course we want to help. It's difficult.
It is challenging because a lot of veterinarians are carrying their own emotions in addition to the emotions of their teams and their clients. And because we're human, right? And that part, I think, is separated too often in remembering that that's a skill set we all should work on, is that balancing life. But I don't know any veterinarian that is good at setting down a case that was sad or deeply, you know, disturbing in whatever way. You know, I don't like diagnosing terminal cancer in a 6-month-old puppy. Like, that's the most horrible news I get to deliver, right? But we carry that, right? And so that's what contributes to this mental health, and understanding that if we are sharing that time, being compensated for it is being compensated, sure, in terms of money, because the money side is huge. And there's other ways to help protect our veterinarians, and not just money, but we do want to understand the money side. So as you talked about, like, there's a lot of investment in your time, the years of education and the source of, you know, our career training is exceptionally expensive. And the average wages are not appropriate at all. They're certainly not proportional. And I can
better now than I would say when we graduated, but the cost has also significantly gone up. So the ratios, you know.
Yeah. It's challenging, right?
Yeah.
In order for the teams to make more. It's like a mechanic. They say, like, it's very similar. Like, you have to pay for the exact cost of all the parts and the labor. So it makes it really difficult to handle financially as a family that's paying for those goods or services, even though it's a medical profession. But then veterinarians have all these other sets of costs that I think we forget to mention if we're looking at just dollars. So our student loan payments are massive for most of us. If you don't have them, you are blessed.
And I want to make sure people understand. One of my colleagues has been in veterinary medicine for years and years and years. And due to the interest rate and the payments, now owes more than was originally taken out, right? And again, I think we're talking to a population that might understand, but you may not know. You may be like, they're working a pretty good job, but they might have made all of their payments and they literally owe more money than they took out initially. That's, yeah.
It's true, astonishing. And I mean, that applies to me. It's certainly one of those things that you like try to like hide from, but carrying that burden, that financial burden, also affects your mental health, your capacity. Day-to-day costs, like your normal living expenses, like the idea of having a mortgage in our heads that you're paying for, and then also a mortgage on a house. You're like, I don't know if I can do those. I physically can't move enough money in my, paycheck to be able to do that. Business costs, If you're a veterinarian as part of a company, you may have the company covering some of those costs, but many of us also, when you do something outside of that company, so that means if you're working as an independent veterinarian with a shelter or rescue or foster group, not as part of a clinic, you have a whole set of expenses that you as a sole person are responsible for. Business insurance. You have the cost of your licensures. If you're using anything
Oh my
like
goodness.
drugs,
DEA licensure,
Right.
wow, so
it's
expensive.
So
My
expensive.
gosh.
There's
Yeah.
liability insurance that you have to
Yep.
carry, and that's just for you.
Yep.
So when we look at groups that we want to work with, and do they have teams that are also being protected as far as the cost bubble goes? Like, is your team insured? Are your technicians and assistants that are helping me do my work as a veterinarian, are they protected, or do I have to protect them? Am I liable
Yeah.
for that? So that's going to increase that anxiety just around like dollar signs, as well as usually, just worry. And then things like scrubs, things like your loops, if you use surgical loops, those are the special ones for doing visual surgery at a safer distance and zooming in. There's stethoscopes. There's, if you're using any type of material that you're expected to bring, surgery supplies, if you're bringing them, versus if an organization already has those costs already taken care of. So just the dollar parts of it are much more than just a wage and student loans. Are there any other costs that I didn't mention there?
Yeah, I'm trying to think of I mean, obviously we're lucky if a hospital can support our, membership fees into organizations, but sometimes they don't for all. They might just do, one large organization, but you really think it's important to be parts of others. So some of those fees, like some won't cover licensure at all. They can't do it. So again, they add up. The gas to go back and forth is so expensive,
Yeah, travel, mileage, wear and tear.
Yep. Thing I
time
have, oh, I'm so sorry. All right. The thing I also think about, and you mentioned it, is if I'm volunteering my time, what happens if I get hurt or someone gets hurt with a certain patient? Who covers that? Who takes care of that? That kind of liability. I'll tell you, a lot of our new students are very, very concerned about liability and the legalities of having something negative happen, like aside from social media and all of those things that could be part of it, but they're very, very concerned.
The risks unfortunately keep mounting, and
Yeah.
each of these risks make it less and less likely for veterinarians to engage. Again, nothing to do with whatever your organization does or believes or acts and the goodness of what they do. That risk of personal injury is huge. The risk of litigation is growing and increasing. And for us, because we're a licensed practice, if there's ever any litigation or anything that is potentially concerning, can risk our ability to have a license ever again or in another state. So now we're holding this fear of, if I have some litigation at any point in time, I literally might lose my entire profession that I've trained for and thus not be able to pay my own. Like, it's a really snowball type of thing. And you're right, social media. So we're risking that association with an organization unless we know them really well. So establishing that relationship and ensuring that whoever you want to work with knows a lot about you and what you're committed to. There's more and more of the law side that, again, keeps kind of impacting, I think, groups' ability to interact with a veterinarian or gain a partnership. And it's because the requirements on record keeping is different from state. The requirements of follow-up care is different from state to state. So I could say, I'll come hang out with you guys for the day, but I'm legally responsible for this whole set of records. And when can they have access to that? And does the client have access to that? Were they done correctly? Because it's my license on the line, or what is the follow-up law in that particular state? Because you have to provide follow-up care and documentation for clients. And maybe that organization you're working with doesn't know that. So all of those things are really daunting, especially when you don't know them. So when I think about that, I know I have ideas, but if an organization were to come to you, Michelle, and say, like, we would love to partner with you, and this is what we thought about already, Where's some
Yes.
things on that I've already thought of list that would make you go, oh, let's talk more?
Yes. Here are the medical records. Here are what we expect as documentation. If you don't do a lot of record keeping, or it's like one written form, I have to tell you, I would think a lot of people might be reluctant now. Just because, again, things get litigious. And I saw a comment in the chat about how people go to social media. That's one aspect. And then other people attack the practice or the rescue or the shelter, and that's detrimental. So having a medical record system where you could say, here, you can record your physical exams easily and quickly, because we know your time is valuable, but you still have time to document your conversations with whomever, and exactly what you saw in the pet, because, and by the way, that protects whatever volunteer organization is using this doctor as well. This is protection on both sides. So, do they have payment in mind for you? You can establish that. What kind of time do they expect from you? And please be honest about the amount of time. If you're like, I would like you for a 4-hour shift, but if another surgery comes in 10 minutes before your 4 hours are done, we expect you to do it. Just tell them that. I think the majority of doctors are very upset that, they don't know the true like guidelines. So just be honest about that, right? So time, medical records, will they get a break? It may sound silly. I think it may sound silly to some people, right? Like, we're all so busy. Who's thinking about a break? But I think, Ray, you and I in our generation, we're like, we could take a break after, we could help out the animals. But these newer doctors are thinking about their well-being, and I'm proud of them for that. So, hey, every 2 hours, we're going to give you 5 minutes, because we know how important it is for you to just take a step back and take a breath. Oh my gosh, I never would have thought of that as a young doctor. I think that would really impress some doctors, So all the basics, we have scrub tops here. Don't worry about it. And then you can leave them here. We'll launder them. If you forget your stethoscope, we've got it here. Don't worry. We've got pen lights. We've got gloves, that kind of thing. Not always easy to have all of those things, but
They're little things, and those little things add up. And so
Yeah.
just the idea of, oh, they thought about me already.
yes.
Like, it's really challenging and an opportunity for me to go, okay, again, I'm going to ask for X, Y, or Z. And
Yeah.
it's a little daunting for me to always say, what are you guys paying? Because I'm preparing mentally for the answer of, what? Why would I pay you if you're, like that's, I'm just being honest. Those are the things
Yep.
that I'm already thinking of. So I'm like building up my energy to go, what is the pay? Or do you cover mileage? Or like,
Yeah.
if you're going to come to me, like, hey, this is our standard. Like, this is what we do. We cover mileage. We do this. This is all we can afford to pay you here, but we would pay you more if we can't. And this is what we've done to make up for it. It was like, actually, we got a donor for this. And this is what we're paying because we respect you and your skill set, and we want you to enjoy your time and continue to have a
Yep.
relationship with us. Thank you. Like, just coming straight with those things, I think makes
Yes.
a difference.
And the other thing I'm going to mention, I don't know if anybody does this. I would tell you to allow them to come in for a shift and then see how it goes. How do you feel? Like, is this something we could book another 2 shifts for, rather than maybe trying to book them or put them on the books for a month? I don't know if anybody does that. I just want to make sure I mention this. I think sometimes doctors have to see just what's ahead of them that day. And then they put so much weight on how that day goes if they have other days scheduled, if that is clear, right? So we want to see how the day goes, and we want to go from there.
I think that's a good point, because I think there should be a mutual interviewing process, because again, we don't want a veterinarian coming and not meeting expectations of what the
Yes.
needs and wants, and vice versa, right?
Yes.
So if you set up those types of things, like, hey, this is our get to know you day. We want to get to know
Yes.
you, we want you to get to know us, that relationship building thing.
Yep.
We're here for that. That is low stakes, and it's
Yes.
good for both sides.
And I know funds are so tough, right? I know, but I do think it would benefit both the doctor and the organization to have a day like that, a get to know you day, a shadowing day that maybe you pay them a small amount for, because at the end of the day, by the way, you also may not, that personality of that doctor may not jive with your organization. And you would benefit from knowing that right away,
Right. totally
So,
mutually beneficial.
Yeah. I mean, my sparkling personality, I find works in many, many different situations, but that's not for everybody.
It will be for all of us.
I swear I'm just
I work in
kidding.
my house every time. We could talk forever about this.
Yes.
But a couple things I want to make sure that I give you guys a context for, and someone had mentioned in the chat, is why are there so few veterinarians? So we've got a couple of things going on. One is we kind of had a professional shortage before COVID. And then after COVID, when so many people had animals, now we have even fewer veterinarians who said, this is it, I have to leave, or I can't handle this kind of mental, pain and anguish of the schedule and not being able to have this relationship and the pressure. They left the profession. So we didn't gain any more really during COVID. We gained a lot more households. And at the same time, we're looking at the last 50 years of trend, the number of pets and seeking care and the number of small animals and households with animals has continued to rise. And even though, while we know the human population rises as well, there's almost 200 medical schools in this country, in the United States. So I can't speak for the world or Canada.
Yeah.
Sorry, I don't have those numbers in my brain. And they're producing over 100 students a year often per class. And there are 32 veterinary schools.
Yeah.
The numbers don't match. So population-wise, we also have a wild disparity in who is participating in profession. So the veterinary profession is wildly disproportionate, probably one of the least diverse professions in professional professions, that it is so difficult to gain more youth interested in our profession. That is just another caliber of things. The change from private practices to corporate practices, and all the parameters and the markets and the financials, big money behind it. So all of these things are making this really difficult.
Yes, there are, and this is for everyone listening. Also, there are 12 more schools right now in the pipeline, I believe, that have been approved to get started on training veterinarians. Some of them will be a different model, and I won't get into the models of veterinary school, but there's some different models in order to make sure we're allowing for students to come in, we can graduate more veterinarians to be there in the profession. I will tell you though, something I didn't expect is I had new doctors who wanted to be veterinarians all their lives. And after 2 years in practice, they left practice. And that is something I didn't expect. And I think there's multiple causes for that. And this is my opinion, right? But Ray, you mentioned some of it. Just again, we're going into potentially, and I'm not blaming any corporate practice. This is not anything about corporate. What I'm just saying is looking sometimes at a business model, then sometimes we have to shorten appointments so we can get as many appointments in, so we can, value the business and make sure we're paying our employees. But I think the business model of the ever decreasing appointment time is very difficult for some of our doctors. It makes me feel like I can't give the care I would like to give. I've tried 15-minute appointments. It is incredibly, incredibly difficult, let alone 20 minutes. And so we have that. We have technician shortages, right? So we don't have enough support. So now things get backed up. As a doctor, I love jumping in and helping, but some doctors are trying to keep up with their paperwork. Some doctors are trying to keep up with hydrating. There were moments I didn't even use the restroom, like 17-hour days. I realized I didn't use a restroom, right? So, we have the shortage of assistants, we have a shortage of technicians, and that all spirals because as a doctor, if we're waiting, for a technician to help us with something, again, I'm not saying everybody will wait. So we are overwhelmed because we want to see those emergencies. I fit them in, we're trying to fit them in. There are so many layers to this onion, right? It starts with school, right? Because we have so few. And I did see someone mention pipeline. I love that they mentioned that. The truth of the matter is, if we want to encourage people to be veterinarians, we probably have to expose them in middle school, ideally younger, but middle school is where it's at. So not a high school, not college, right? So this is what people like myself and Ray are doing. We're trying to, and if Dr. Nicole Bruno and BlendVet, she's trying to get access into these like middle schools, fabulous program. But I love that. Yes, middle school. Yes. And that's how we spark interest, but we need to spark this interest and we need them to understand the realities of what it looks like when they get to practice, because then maybe I won't have that student that was in practice for 2 years telling me they decided to leave because they realistically don't know what it looks like.
All
So many
right.
things. Oh, sorry. Yeah.
Thank you, Michelle.
no,
Hi, Dr.
Yes.
Michelle. Thank you, Dr. Ray. This was a great conversation. We will continue this conversation on Maddie's Pet Forum. I'm sorry we couldn't answer your questions, but any questions that we have, we're going to add to Maddie's Pet Forum. Thank you, everybody. Have a nice rest of your week.
Thank you so much, everyone.
Bye.
And we'll have plenty of opportunity to ask questions, but I think a lot of the questions that people asked, we were able to kind of answer in dialogue.
Yeah.
Uh,
I know
like
I was
said,
trying to squeeze them in.